We're going to be talking about schizophrenia. We'll start with some symptoms, we'll go over some incidence rates, and then we'll talk about a little bit of treatment and kind of the different subtypes and all these other things. In previous videos, we talked about mood disorders, obsessive compulsive disorder, post-traumatic stress disorder, anxiety disorders in general, and mood disorders in general. So if you're looking for those, please make sure you go back and watch those other videos. But today we're talking schizophrenia, and the images you see on the screen here were actually drawn by a person with schizophrenia while they were being treated at a psychiatric hospital. What I think is interesting about this image is they're not two separate images; they're the same image. They were created according to the person with schizophrenia as complementary images, that they were in somehow supposed to be tied together. Which I think is an important first realization when we talk about what schizophrenia is and what it's not. So first off, we should be pretty clear about what schizophrenia is. Schizophrenia means split mind. It comes from the Greek. But when we talk about split mind, we're not talking about split personalities or multiple personalities, or as we'll see, what that's now called dissociative identity disorder. But we're actually talking about being split from reality, not really knowing what's real and what's not. Usually, schizophrenia is characterized by a number of very powerful and potentially devastating symptoms. So first is disorganized thinking. One of the things that we see with people with schizophrenia is that they have delusions, right? They believe things that aren't true, right? So they can be delusions of grandeur, where someone believes that they're like Napoleon or Jesus or the President of the United States. They can be delusions of persecution, right? They could feel like someone's out to get them and that they're being watched by some government entity or something else that they believe that they are being hunted or something. And that leads to these, kind of fantastical beliefs that people with schizophrenia will say things that are just completely outlandish. And that's because that is a symptom of their disease. Usually that presents in something that we call word salad. So it's a loose connection of words that either rhyme, look similar, or have some other similar properties. Word salad is not just gibberish, although it does often not make sense. Sometimes people with schizophrenia will get like stuck in a pattern or a cadence of a phrase and just repeat it and then fit other words into it, and they just can't stop. We'll look at some examples of this in class, but it's important to know that is directly related to the disorganized thinking, right? It's almost like a person can't hold on to a thought long enough to finish their point, that it just immediately gets distracted by something else, which is actually how we see that there's deficiencies in working memory with people with schizophrenia, right? That they just can't remember, certain tasks or hold things in their memory for long enough to really find these connections. It also can explain why people see connections and things that aren't otherwise connected. So you see, people who will say, they know what a photograph is thinking or something like that. Like, it's just, there's a disconnect from reality. Another major symptom of schizophrenia is hallucinations. Usually these are auditory hallucinations, meaning that you hear voices, but it's not necessarily always the case, right? An hallucination is really just sensory information without any sensory input. So you're hearing something, you're seeing something, you're feeling something, you're tasting something that isn't actually there. So it's a false sense. So like I said, most hallucinations for people with schizophrenia are auditory, but they can also be any sense, right? They can be visual. They can see things that aren't really there. They can be somatosensory. They can feel like something's on their skin or that they're touching something. Or they can be olfactory or gustatory, right? Smell and taste, right? You can taste something that isn't there. You can get a bad taste in your mouth that comes out of nowhere, right? So again, combine that with the delusions and the other forms of disorganized thinking, and you have a really devastating disease. Oftentimes, these auditory hallucinations are voices making either insulting comments or commands to the person. So A lot of times patients with schizophrenia report being, their voices are telling them that they're bad, or that they've just killed somebody, or that they've, engaged in some sort of criminal conspiracy against the government. Or they're telling them to do things, right? Which is one of the reasons why schizophrenia is relatively scary when it's first diagnosed, is because you're believing that you are being commanded to do something that might actually be violent. Although I should say immediately following that statement that the vast majority of people with schizophrenia are not violent. There's a very, very small percent of the population with schizophrenia, which is already a small percentage of the total population, that acts out on any violence. Right, most of the time, medication and therapy can help kind of stem some of these thoughts. And a lot of people with schizophrenia know that that's just their voices telling them to do things. It's just hard sometimes for them to understand, is that the hallucination that's telling them, or is that their own inner monologue that's telling them to do something. And then last, really, we should talk about these inappropriate emotions or behaviors, right? First off is catatonia, which is basically just like sitting or not moving for long periods of time. People with catatonia can often be found for hours in a really uncomfortable position that their body just got into, and then they just couldn't get out of it. You see people with schizophrenia that'll have joint issues or ligament issues or muscle tears or something, just because of the way that they have been catatonic for a long time. And then compulsive actions. You'll see repetitive behavior sometimes. You'll see facial expressions. You'll see basically things that are inappropriate. So you might read a really sad story, and someone with schizophrenia might laugh hysterically, thinking it's the funniest thing in the world. You can see how there's these inappropriate emotions tied to all of these things, and taken together, right, that this is a really devastating illness. You can imagine not knowing what's real and what's not, and hearing voices and thinking things, from your own standpoint, that it all makes sense. It almost feels like the whole world's gone crazy except for you, which can be really frustrating and really traumatizing. So within the umbrella term of schizophrenia, there are a number of subtypes, and you'll need to know some of the names for some of these, and I have some graphics and stuff on Schoology that we'll take a look at that help explain them. But basically, the subtypes come down to whether we're talking about positive symptoms or negative symptoms. And this is just like positive reinforcement or negative reinforcement, right? It's not good or bad. It's whether or not a symptom has added onto what we would consider neurotypical behavior or thought processes, or something has been removed. So, for example, delusions, right? Delusions are a positive symptom. It's something that occurs that shouldn't otherwise occur. Same thing with hallucinations, right? It's a symptom that causes something to be considered like real, when in reality there's no follow-up or no basis for it in fact. Negative emotions, on the other hand, would be something like catatonia, right? It's a loss of movement, or maybe even in some extent the limiting of the working memory, right? It's a loss of an ability. So if something is added to the person's affect, language, thought process, behavior, that's a positive symptom. If something is lacking that would otherwise be considered normal, that's called a negative symptom. Some other kind of really interesting things here. Oddly enough, the people that have slowly developing schizophrenia, whereas that it kind of, you see the signs coming for a long period of time, they are less likely to recover than someone who has like an immediate like psychotic break and then develops schizophrenia. Also, I should say that psychotic and psychosis, that's the state of being, I guess, schizophrenic. That when you have the delusions and hallucinations, that mental state that you're in, experiencing all the symptoms of schizophrenia, that's called psychosis. And we see psychosis in other things, right? There can be drug-induced psychosis. There can be trauma-induced psychosis. But if it's just out of, if it's not caused by anything else like that, then psychosis is almost always schizophrenia, unless it's a certain personality disorder, schizoid personality disorder is characterized by some psychosis. But those people who have the kind of immediate uh, symptoms come on at once, and it kind of is really devastating, those people actually have a better chance of recovering than people who have it the slow progressive type, which is a little counterintuitive, right? You would think that something being kind of like floodgates opened would be harder to treat and recover, but actually it's the ones that you see the signs kind of building and building and building over time that it becomes really much more difficult to treat. And we also know that those people with schizophrenia that have the positive symptoms, right? Remember, not everybody has positive symptoms. Some people have the negative symptoms only. That the positive symptoms, there's better outlook, right? The medication that we have for schizophrenia, which is by far the most appropriate way, I guess I should say, to treat schizophrenia, is through medication, psychopharmacy. Or psychopharmaceuticals, I should say. That's better with positive symptoms. The medication that we have pretty much does wonders for things like delusions and hallucinations, just not so much with the catatonia and some of the inappropriate behaviors. Those things, not so much of a good outcome in terms of medication will resolve some of these symptoms. So let's talk about how we understand schizophrenia. Uh, Basically, it's a brain disease that has psychological ramifications. One of the things that we see is it's the main characteristic of schizophrenia is overactive dopamine receptors. Basically, the brain is flooded with dopamine. People who have schizophrenia, right, and that leads to them having more dopamine receptors in their brain. We then use dopamine blockers, right? Antagonists of dopamine, to use our psychology language, to basically alleviate any of the positive symptoms. So the flood of dopamine in a brain can create things like hallucinations and delusions. And if you're thinking, Mr. Veer, like, wait a minute, this is dopamine is also the if the feel good thing. It's what you feel when you take illicit drugs, right? That's the high. Well, there's a reason why certain drugs, especially psychedelics, are just full of dopamine, and they have the same exact symptoms as people with schizophrenia, which is why we can talk about something like drug-related psychosis. So, blocking dopamine from someone with schizophrenia, kind of reverts them back to neurotypical behavior, affect, everything. All those positive symptoms start to go away when you put someone on dopamine blockers. And then there's an agonist of glutamate, again, right, to the negative symptoms. If you remember, glutamate has to do with muscle movement. So, thinking like catatonia, right? Getting more glutamate into the system can help someone move a little bit easier, which then makes it a lot easier you know, to move and treat the catatonic symptoms. We also know that people with schizophrenia have extra large ventricles, which are the gaps that are filled with cerebrospinal fluid in the brain. We'll take a look at. I don't have an image ready to go here, but in class I'll show you what that looks like. And we also see a loss of cerebral tissue, right? So you can see here, if you look at average loss of cerebral tissue, you see that's much more progressive in adolescents with schizophrenia, right? That they're losing this the cortex to the disease, which is why we talk about it. It's a brain disease that has these psychological ramifications. We also know some other things. Brain activity is especially low in the frontal lobes, right? Remembering frontal lobes are decision making, planning, basically those long term executive functions, which are completely devastated with things like delusions or hallucinations. Um, and basically, the brain is very rhythmic. If you were to look at an EEG, you would see very rhythmic brain waves going on. We looked a little bit about this and when we were talking about like sleep and states of consciousness. But with schizophrenia, there's no normal rhythm here. It's just pretty much a very chaotic EEG. So other kind of factors here. We know that there's a prenatal environment that can lead to a higher likelihood of developing schizophrenia. So a couple things: low birth weight, um, which is related to famine during conception. If the mother is especially is hungry um, or starving, even that can lead to schizophrenia later in life of the child, not of the mother. Also, one of the biggest things we see is in the first half of pregnancy, a viral illness is a very high correlation to developing schizophrenia later in that fetus's life. So again, you have some environmental causes here, but we absolutely know that there's a genetic predisposition, which I think I have a chart for that in a second. We know that adopted children, if they're more likely to have schizophrenia if their birth parents have schizophrenia. We've done it with twin studies. Um, and we also know that kind of interesting thing here is oftentimes there's no signs, there's no warning signs, which is again leads to this, the absolute devastation that schizophrenia can have. Is someone could be, quote unquote, normal and healthy, and then just slowly develop psychosis, and then they have schizophrenia. So it's a really serious disease, a really serious disorder. And it's one that we certainly have to take seriously. So here's that chart. Again, general population risk for schizophrenia is about 1%. It's has stayed about 1% for the last 100 years or so since we moved to the medical model and tracking these things. But you can also see how there's a strong genetic component, right? Identical twins. If your identical twin has schizophrenia, it's almost a 50% chance, right? A coin flip that you're going to develop it as well. If both of your parents have schizophrenia, right, you have a much higher likelihood of developing it too. So there's some interesting components here that drive this genetic uh, uh, basis to schizophrenia. Um, People always point out on here, just I'll bring it up, a spouse of the patient, that is higher, right? And people are like, well, how does that matter? Uh, I think that is just a statistical thing when we look at people with schizophrenia, that they might, you know, be in support circles, and they might be more likely to be able to relate to someone who also has schizophrenia, right? There's a lot of stigma that's associated with this disease. So finding someone who has it, who's lived it, um, that can have a major, people can feel better about that, and it makes sense that they might have a higher likelihood of marrying someone who also has schizophrenia. Um, so in class, we'll watch a number of videos of people talking about their psychosis, patients undergoing psychosis, and you can kind of see what it's like for people both to think back on their psychosis, and then also to think about how people are experiencing it in the moment. So that's it for this video. In the next video, we'll talk about dissociative identity disorder, personality disorders, and probably also somatoform disorders, the bodily disorders that are only in your head, that have no physical cause, I guess I should say. And yeah, so in this video, we talked about the symptoms of schizophrenia, the subtypes, difference between positive and negative symptoms. We also looked at how this relates to the brain, right? That this is a brain disease that has psychological ramifications. And we looked at the genetic component of it here with this chart. If you guys have any questions, you know how to reach out to me, and I will see you guys in the next video. Take care.